Mounjaro. Okay, you've probably heard the name by now. It's a once-a-week injection that is making some serious waves, tackling two of the biggest health challenges out there, type 2 diabetes and obesity. So, is this just another drug in the lineup, or is it a genuine game changer? Well, we're about to dive deep into the science, the data, and what this new medication really means.
Right off the bat, what really sets Mounjaro apart is its dual-purpose design. And this isn't some happy accident or a surprising side effect. No, this drug was engineered from the ground up to be a powerhouse treatment for both type 2 diabetes and for chronic weight management. And this really gets to the heart of it. Just think about it. One single active ingredient is taking on two absolutely massive health issues. So on one hand, you've got this powerful tool for type 2 diabetes, and on the other, it's a super targeted treatment for weight management.
So, who is this actually for? Well, for diabetes, it's for adults whose blood sugar just isn't getting under control with diet and exercise alone. And for weight management, the guidelines are super specific. It's for adults with a body mass index, BMI, of 30 or higher, which is the clinical definition of obesity. Or it can be for folks with a BMI of 27, which is considered overweight, but only if they also have at least one other weight-related health problem, like high blood pressure, for instance.
So the big question is, how on earth does one single drug manage to do both of these things so incredibly well? Well, the secret lies in its active ingredient, a molecule called Tirzepatide. And this, my friends, is where the real innovation kicks in.
Tirzepatide is what's known as a dual GIP and GLP-1 receptor agonist. Yeah, I know it's a total mouthful, but all it really means is this. When you eat, your body naturally releases these two key hormones, GIP and GLP-1. They're like little messengers that tell your pancreas to handle the sugar and tell your brain, hey, you're full. Tirzepatide is the very first drug ever designed to mimic both of these hormones, basically giving your body a supercharged version of its own natural signals.
And here's the magic right here, the key to its power. It's all about where these hormone receptors are located. See, they're not just in the pancreas, where they're working on blood sugar. The crucial part is that they are also in the parts of your brain that control your appetite. That's the dual action mechanism in a nutshell. It's fighting a two-front war, right? It's working on your metabolic system and your brain's hunger signals at the exact same time. Okay, so let's follow the journey. After that simple injection, Tirzepatide gets right to work flipping the switches on both those GIP and GLP-1 pathways, and that unleashes this incredible two-pronged effect. In the pancreas, it helps your body make and use insulin way more efficiently, which brings your blood sugar down. And at the very same time, it's sending signals to your brain that help regulate your appetite, making you feel fuller and naturally leading you to eat less. All right, so that's the theory. That's how it's supposed to work on paper. But did it actually pan out in the real world? Well, to find out, we've got to look at the numbers from its massive clinical trial program, which was called SURPASS. So check out this first chart from the SURPASS-1 trial. This one compared Mounjaro to a placebo, a sugar pill. Look at the graph on the left. That tracks blood sugar. See that top dashed line? That's the placebo group, totally flat. Now look at the incredible drop from the 3 different Mounjaro doses below it. And the story on the right for body weight is just as clear. The placebo group, they barely budge. Meanwhile, the Mounjaro groups show this significant, steady drop.
But the real test is seeing how it stacks up against another powerful drug that's already out there. And that's what SURPASS-2 did. This was a head-to-head battle against semaglutide, which is a very effective medication. Now, in both of these charts, that top line is semaglutide. The 3 lines below it, those are the Mounjaro doses. And honestly, the data speaks for itself. At every single dose, Mounjaro was superior to semaglutide at lowering both blood sugar and body weight. And to really get a sense of just how big that difference in weight loss was, look at this chart. It answers a really simple question. How many people lost a truly life-changing amount of weight, 15% or more of their body weight? For the highest dose of Mounjaro, it was nearly 40% of patients. For semaglutide, it was under 9%. I mean, that's not just a small difference. That is a massive gap.
Okay, the results are obviously incredible. But with any powerful medicine, we have to talk about the other side of the story. We have to look at the risks and the side effects.
So with results this powerful, you have to ask, right? What's the trade-off? Because let's be real, in medicine, there's almost always a trade-off. So let's flip the coin over and look at the potential side effects.
The most common side effects, by a long shot, are gastrointestinal. We're talking about things like nausea, diarrhea, vomiting, and constipation. And this isn't really a surprise, right? It makes a lot of sense because the drug is directly influencing your digestive system, so that's often where you're going to feel it first.
But here is some really crucial context. While those side effects definitely don't sound pleasant, the trial data shows that the vast majority of them were reported as mild to moderate, and maybe even more importantly, they were most common right at the beginning of treatment or when a dose was increased, and they tended to fade away as a person's body got used to the medication. Now, there's one very important warning everyone needs to be aware of. The risk of hypoglycemia, that's dangerously low blood sugar, goes up quite a bit if you take Mounjaro in combination with certain other diabetes drugs, specifically things called sulfonylureas or insulin. So if a patient is already on one of those, their doctor will probably need to lower the dose of that other medication to keep things safe.
So managing those side effects is a huge part of the whole treatment plan. So let's get into the practical side of things and look at how this medication is actually used day to day.
You don't just jump right into the highest dose. The whole philosophy here is start low and go slow. And this gradual process, it's called dose escalation, is specifically designed to let your body adapt and to keep those side effects to a minimum. So everybody starts on a very low 2.5 milligram dose. After a month, they bump up to 5, and from there, if needed, the dose can be slowly increased every 4 weeks, climbing up towards that max dose of 15 milligrams.
And the actual process of taking it, it's pretty straightforward. It's a once-a-week injection that patients give to themselves. It just goes right under the skin. That's what subcutaneous means, either in the stomach, the thigh, or the back of the upper arm.
And you might see this little symbol on the packaging. This black inverted triangle is actually pretty important. It just means the medicine is under additional monitoring. Because it's a newer drug, regulators are keeping a super close eye on its safety to quickly catch any new information that might pop up. It's a totally standard and reassuring process for a lot of new medicines. So where does this all leave us? Mounjaro is clearly more than just another drug. It's the very first of a whole new class of these dual-action therapies. The results from the clinic are, without a doubt, impressive. But they also come with a clear need for careful medical supervision to manage those trade-offs. And it really makes you wonder, right? As we develop even more powerful tools like this to tweak our own body's basic systems, how will it completely redefine how we treat metabolic diseases like diabetes and obesity for generations to come?